Welcome to the Thurston County Board of County Commissioners work session. I think it's our fourth for this Wednesday, May 19th, 2021. It is 1:31 p.m. My name is Ty Mentor, Chair of the Board. We have participating virtually Vice Chair Commissioner Gary Edwards and Commissioner Carolina Mejia. We have our County Manager, Mira Chavez, and Assistant County Manager, Robin Campbell, IC Director of Public Health and Social Services, Shelley Slaughter, and Carrie Hennon from our treatment sales tax team. And we have half an hour slated to address treatment sales tax community grant awards. We have public attendance provided through our county YouTube channel or through a conference line at 360-252-9020, PIN 1234. The agenda indicates that a decision of the board is requested, and I will pass this baton to the county manager.
Thank you, Commissioners. This is a yearly cycle where you will be hearing from the staff the proposals they have received in terms of the community grants. As you may recall, you set aside $250,000 for community grants. And also they'll give you a perspective on the selection process and the proposals before you. This is something for you to consider. Depending on the questions that you may have, I will bring this for a final decision and consideration next Tuesday morning. Carrie or Shelley.
Good afternoon, everybody. Shelley, did you want to say anything? All right. Good afternoon, Carrie Hennon, Public Health and Social Services. I'm our Treatment Sales Tax Program Manager. I know we only have half an hour. I wanted to very quickly introduce Kelsey Paolini, who is new-ish to the county. She joined us in March as the Treatment Sales Tax Data Analyst. So very happy to have her. And she's been working on all kinds of things, and hopefully you'll get to hear from her again on more TST business soon. Okay, so as Ramiro mentioned, every year, or in some cases every other year, depending on the budget cycle, we run a request for proposal process for a relatively small amount of treatment sales tax funding. That request for proposal goes out to the community. A range of community agencies have the opportunity to respond, make proposals on TST eligible projects. So that this year, that RFP went out at the end of February. Proposals were submitted in April. We received 8 proposals, totaling almost $700,000, and we have $250,000 in the budget. So as usual, there are more great ideas than we have funding for. So we convened a review team to look at those proposals, and that team has a recommendation for you today. So the review team included 3 members of the Treatment Sales Tax Advisory Committee, 3 county staff, and 1 representative from the Thurston Mason Behavioral Health Administrative Services Organization. Would it make sense for me to share my screen with one of the?
Yeah, please do.
Okay. It never works when you're in the heat of the moment to have the thing that you want, does it? Okay, there we go. Share. That's not sharing what I wanted it to, is it? That's just my Zoom screen. Stop share. Sorry, there we go. How about a document with some green on it and a grid? Is that what you're seeing now?
Yeah, you got it.
Good, okay. All right, so this presents to you the 8 proposals that were received with a very brief summary of each one. And the recommendation from the review team is to fund the first 3 on this list with their full request, and then the 4th one with a partial funding of what they requested. So the proposals received, I'll kind of go down the list. There's a proposal from Family Support Center of South Sound. They are currently receiving a TST community grant that is set to expire at the end of June. They requested additional funding going forward. This program funds a case manager that works out of the Pear Blossom Place Family Shelter, and that case manager is really focused on identifying families at Pear Blossom Place with behavioral health needs and connecting them to treatment and other services needed to support their treatment. So that proposal was considered to be very strong, addresses obviously homelessness as a really important community issue, and kind of hopefully helping to address some of the underlying needs related to why families are experiencing homelessness. So that was of great interest to the review team and was recommended for funding. They requested about $89,000 and the review team recommended funding that at its full amount. Shall I continue going through these and then have the questions after that?
Yep, let's do that because the time is short.
Okay. All right, I'll talk faster. YWCA of Olympia requested funding for their youth council program. This is not a current TST community grant recipient, but is a former TST community grant recipient. So this provides kind of a range of programming, navigation services to connect to services, peer support, community building for youth ages 12 to 17. The review team recommended fully funding this at about $46,000 and called this proposal out, especially for strength with respect to promoting racial equity, serving young people who may be sexual minorities or LGBTQ populations. So this, again, was also very well received. Third on the list, Monarch Children's Justice and Advocacy Center. Again, familiar to TST, so the Monarch program received TST community grants for a number of years. They are in the 2-year grants that we are wrapping up right now. They are not currently receiving funding, but they did request additional funding. This program provides treatment services for child victims of sexual abuse and other family members, non-offending family members. And so this was also recommended for funding. So those first 3 were recommended for kind of the full amount of funding they requested. Then as we got down the list, we had lots of great discussion in the review team about other great proposals that of course we weren't able to recommend funding all of. But what the review team landed on was this item that appears 4th here, a proposal from Northwest Resources. This proposal, so Northwest Resources is a large, well-established behavioral health provider, provides a lot of substance use disorder programming as well as mental health programming. And what they would like to do is kind of true integration. We have talked a lot in the behavioral health field about we need to integrate mental health and substance abuse, and we need to integrate mental health, substance use, and primary medical care services. The field has talked about that more than we have actually done it, I would say. There's been a lot of financial integration, but actual clinical integration has been limited, especially in the direction of bringing primary care services into behavioral health settings. There's been more of the opposite, but the idea of bringing primary care services into behavioral health settings is not widely practiced. They made a request for $100,000. The review team, again, kind of running out of money, proposed funding them at the minimum amount they said they could work with, which was $30,000. I think what appealed to the review team about this proposal was, one, as I said, this is new and different and innovative. This isn't being done a lot of places. And 2, they have a very clear plan for sustaining funding through this by billing Medicaid, billing billing private insurance. So the idea is, with some seed money, could we assist in getting something sort of innovative going? As you might note from the very bottom of the page, this brings us over budget. So that would bring, as I think Ramiro noted, the budgeted amount for TST community grants is $250,000. The total of this recommendation is $265,000. I believe that is easily achievable within the adopted budget. because in the same place in the public health portion of the TST budget, we have other areas I think we are very likely to underspend by that fairly small amount. So for example, in the very same line item in the budget with the TST community grants, there's also funding for local match funding for law enforcement assisted diversion. There's $300,000 for that was kind of earmarked for that. I think given where things sit with LEAD, we probably won't get 300,000 out the door this year. So borrowing a little from that, I felt was achievable. So another option, of course, is to not go over budget and either not fund that fourth one or cut any of these down to 250, so that we total $250,000. Just quickly, the remaining proposals were all great, but again, we just couldn't fund everything. So there was a proposal from Catholic Community Services to provide case management and outreach to individuals at the mitigation site in Olympia. A proposal from Family Education and Support Services to provide parenting programming, a proposal from the Olympia Fire Department to fund a CARES model. This is a model getting some attention statewide and nationally, and a proposal from Capital Recovery Center, which would be ongoing funding for a current community grant, doing some outreach and linkage work between individuals coming out of jail and the Butte Clinic. So that's kind of the overview and the highlights. And I think we can probably go to your questions and reactions.
Okay, Commissioner Mejia, can start with you.
Sure. I guess I'll just say that I'm kind of disappointed that FES didn't get any funding, especially during the pandemic. Their services that they're providing to the communities for parents are so essential. And so I see that they got a higher score than Northwest Resources. And so I'm not sure if there's a way where they're providing those essential services to parents right now that not many other organizations are. And I just came through a very long grading grant process with the Regional Housing Council. And so I'm seeing a lot of intersectionalities with some of these organizations. So I guess I'll leave it at that for now.
Yes, so I should have mentioned that in my overview. You are correct that kind of just looking at the scores there, the recommendation, that fourth proposal that was recommended did score lower than some of the other items in that, and you probably experienced this if you were part of a recent funding round, that there's the scores and then there's all the discussions, that the scores kind of served as sort of a jumping off point for all of that discussion. I think, again, the reason the Northwest Resources proposal was sort of elevated by the team was sort of those two factors of innovation and this very clear longer term sustainability plan. I don't disagree that parents need services, especially right now, and that FES does a great job of providing services. The team didn't end up recommending it, but obviously the board can consider any direction you choose to go. I think there were some questions in their proposal about kind of exactly the context in which they were planning on providing services, some things that weren't entirely clear in the proposal, but clearly parents do need services and all the support we can get right now.
Commissioner, was that it, Commissioner Mejia?
Yes, for now, Commissioner.
Okay,
Sir.
Very good. Commissioner Edwards, go ahead.
What was the last group that Commissioner Mejia commented on? She was disappointed they didn't get more attention.
So
Family
FES,
Education
sorry,
and
yeah.
Support Services, sorry.
Oh, okay. The number one position of 89, is that what it was?
No, we have two organizations in this community with names that are similar enough so as to confuse people. So the one that's appearing first on that list, Family Support Center of South Sound, that was recommended for funding. That is the organization that provides services to homeless families as well as lots of other things. I think what Commissioner Mejia was commenting on was Family Education and Support Services. Different name,
Yeah.
but awfully similar, which is, you probably know Shelley Willis. They do all kinds of things, including a lot of parenting classes and support.
I would prefer putting money from the YWCA into the Family Education and Support Services, to be honest with you. So that's just one issue that I have.
Go ahead.
Yeah. And I'm also, I think Ywca Fire has a lot to offer, so maybe I'm showing my bias.
So
anyway,
additional context to provide about Ywca Fire. So again, I do think all of these agencies have a lot to offer, and I mean that very genuinely. Ywca Fire, so as I mentioned that we had a representative from the ASO on this panel. They do intend to reach out to Ywca Fire with sort of an offer of, hey, we might be able to fund a portion of this through some of the funding that they receive, some of the overlap with some of the crisis funding, et cetera. That is, of course, by no means a done deal or a slam dunk, but they are certainly, I think in the conversation, the review team felt like, well, they might have, through either city revenue or partnership with the ASO, they might have some other options that some of these other organizations don't. But that is different from saying there's a done deal to clearly give them $100,000 or anything like that. I think there's opportunities and potential, but that was one part of the discussion.
The reason I'm enthused about the Ywca Fire issue is because those folks are often the first on the scene before, and they see things before anybody else does, and in a different way than everybody else. And they're trying to get there and, I don't know, give NARCOM or deal with a situation that's not good. And I'd like to see any way we can help them be successful. That's all. So, am I biased? Yes, because I see those folks take a beating quite often from their interactions. And I think if we're trying to get some kind of uniformed response, and maybe it's not all police, that, boy, they're next in line from my perspective. Okay, so
I agree. They respond to a lot. Absolutely.
We're gonna be discussing this back and forth, it sounds like. So.
Okay, I have a number of questions. First of all, can you describe, I didn't quite understand the description of what Northwest Resources is doing. You said it's innovative, but I don't quite understand what it is.
So they would like to bring primary care services, so hire an ARMP and a medical assistant to do basic primary care services in their behavioral health clinic. So somebody shows up for their drug treatment group or their mental health counseling, and because they have a relationship with that organization, we know that many individuals with behavioral health needs also have medical needs. So they might be able, the idea is to have them able to take care of some of those medical needs right there in a place they already are showing up. And we have there is some research to show the connection between improved, better medical outcomes, improve your mental health and substance use treatment outcomes, and vice versa. All of these things are interconnected. So
number two, looking at since you brought up the issue of, this has other ways to get funded versus this doesn't. Looking at number 3, the Monarch has been around, I know, and it says here on the form that they do not currently receive treatment sales tax, and they've asked for 100,000, and it's been funded at 100,000. And I guess I'm wondering, that's an area that to me seems like it has a lot of avenues for support. And obviously they were getting support somehow last year without treatment sales tax. So I'm wondering, is this a request that could be cut? You know, if we wanted to put some money in another place, could this request be funded at 50% or something like that? Or is there a specific project that they need $100,000 to launch, or what exactly is that going toward?
Yeah, good question. So they received TST funding for a long time, then they didn't. And yes, they still exist without that TST funding, I think. So they do have some, I shouldn't say that, they definitely have other sources of funding. What their answer would be just how long their waiting list is and, you know, how many people can they serve. So without TST funding for the past couple of years, they would have had, I think they would say they would have had a longer waiting list and aren't able to serve as many people. We, 2 years ago, when they weren't funded, we strongly encouraged them to figure out licensure as a behavioral health agency to be able to draw down Medicaid, to have at least a portion of their services funded. They have said that is not feasible. I don't know if it's feasible. I'm sort of not in their seat, but it's, you know, a conversation I would want to continue to have with them. But I think in terms of like the amount of funding, I think, you know, they would take any amount and could probably work with it. You know, it's just what portion of an additional FTE do you buy or whatever.
Yeah, because it's an ongoing program.
Right. Yeah, it's not, there's not startup costs or that kind of thing.
Okay, and then this is just a comment, I guess, because Commissioner Mejia kind of hit on this, but, and again, since you brought up like with the fire department, you're saying they might have another avenue. My understanding about the family education support services, parenting services, is that they often fall through the cracks of other programs and don't have the same avenues that other programs have. That's just what I think Commissioner Mejia was making that point, and that's consistent with what I've heard as well. And then my next question is, YWCA, in the first box, it says Youth Council with an IL. Is that correct? Or do you mean youth, like counseling with an EL? If it's an IL, what is a council? What is a youth council? That doesn't seem to fit with what the description is.
So it is spelled correctly.
Okay.
But, and let's see, how would I articulate that? I think, so they started with a model called Girls Circle, which expanded to Girls Council, which morphed to youth to be more inclusive of different gender identities rather than the girls name. In terms of I think the council name refers to more kind of the cohorting of it, that this is about support across the group, support across young people. So
that's what they call the peer supporters or whatever, is the youth council?
Well, the participants in the program are, you know, we're all in this together, and we are a group or a council. I can try to get you a better answer for that if you like. That's my articulation.
I just want to make sure I understood it.
Hey, Carrie, can you stop sharing your screen? Sure.
Yep.
Can you stop sharing your screen so we can see the conversation? Thank you.
Okay. And I guess looking at that one, it got a high score. Yes, not currently, in several previous years. So they've had funding from TST before, so it's been around a while, it sounds like.
They had funding from TST before. For the past couple of years, they received a grant from CPAA, Cascade Pacific Action Alliance. That grant is now sunsetting, and so they are back for.
Robin, do you have something?
Carrie, when the YWCA received funding from us in the past, do you recall what their performance measures were and how they did on those?
So they had a lot of performance measures, several performance measures that were related to The impact on individual young people, which we were measuring using the CANS, which is a particular kind of assessment tool. So, asking young people questions as they enter the program about substance use, about suicidality, about some of their strengths, about their connections to education, et cetera, and then asking those same questions again at exit. And they did show a lot of improvement on those improvement markers. I won't be able to cite specific data right now, but we could get that to you if you would like it, to the board.
At the end of the day, they showed success rates based on the measures that we agreed to with them.
Right.
Yeah.
Yes.
Okay, so we have 3 minutes before our next briefing. Is there any other questions from commissioners before we finish? I would contemplate a proposal just to chew on for discussion for Commissioner Mejia and Commissioner Edwards to chew on, maybe allocating $50,000 of the Monarch award to the Family Education and Support Services. That's just, I'm not sold on that or anything. It's just a thought I have based on the discussion I'm hearing, and maybe that could be something we discuss on Thursday or next Tuesday, whenever we're going to hear this back.
Yep.
Okay.
Is there any additional information that I should bring you between now and next week?
Maybe.
Does anybody want additional info?
Maybe, Carrie, you stated that perhaps the $250,000 that's the baseline. The proposal that you have today is $265,000. Can you bring back as to what additional latitude in terms of the funding, just for the board to have a comprehensive understanding of this?
I think she mentioned it was coming from the $300,000 allocated to LEAD, because she does not believe that we will be spending that entire amount.
Yeah, but I think it will
Correct.
be good to have what the ceiling is for Tuesday's conversation. And yeah, that will be a great point of conversation when I will bring this item on Tuesday morning. Certainly you have a great group of individuals, the TST committee that provides recommendations. They look into the details and more in tune of the needs of the community in association with the requirements of this funding source. But also the Board of County Commissioners has the option to accept those recommendations, make revisions, or allocate the way you perceive is adequate from your point of view. There is a proposal by Commissioner Minster, so that will be a great thought process for the other two commissioners to consider before I bring this back on Tuesday.
I would just follow up and say, I love the Treatment Sales Tax Advisory Committee. They do a great job. And my tentative proposal is I would just point out, is respectful of their scoring grid. As Commissioner Mejia pointed out, they deviated from it, but I would be very respectful of their scores and the time they put into this.
Great. Okay, thanks. And yes, I will work on the kind of budget side and come up, Romero, with a how high could we go type of number.
Sounds good.
Thank you. We're adjourned.
Thank you, sir.
Thank you.